Hello and welcome to Getting into the Driver's Seat, a guide to managing your kidney health presented by the Victoria Kidney Care Clinic at Island Health. Please note this presentation is intended to provide general information to people who have chronic kidney disease. Please be sure to check with your GP or specialist for specific recommendations related to your kidney health. During the presentation today, the kidney care nurse will talk about what the kidneys do in the body and self-management strategies to help keep your kidneys healthy. The dietitian will talk about eating well for your kidneys. Then there will be a section on managing your medications. And the social worker will wrap it up with navigating your way through the healthcare system, as well as resources available to help you. Most people are born with two kidneys. They're located on either side of the spine towards the back. Each kidney is about the size of a clenched fist and holds about 1 million tiny little filtering units in them called nephrons. Because they're very tiny, they're very delicate and very prone to damage. So what do your kidneys do? Your kidneys filter waste from your blood. They balance fluid in your body through urination. They balance nutrients in your blood. They make hormones that help you maintain a normal blood pressure, help you maintain normal hemoglobin and red blood cell levels, and also help to keep your bones healthy. So what are the causes and risk factors for kidney disease? Diabetes, high blood pressure, and heart disease are the top 3 causes. Due to the imbalance of blood sugars over long periods of time in the bloodstream, diabetes can cause damage to the blood vessels in the body, including the filtering units in the kidneys. So people who have diabetes are at risk for kidney disease. High blood pressure can also cause damage to the blood vessels and filtering units in the kidneys over long periods of time. Often high blood pressure can go undetected for many years. Heart disease is also a cause of kidney disease, as well as a family history of disease, such as polycystic kidney disease. Certain ethnic origins, such as First Nation, Asian, African, and Pacific Islanders, are also at risk for kidney disease. If you are in any of these high-risk categories, you should ask your doctor about getting screened for kidney disease if you haven't done so already. As well, beginning as early as even the age of 40, people naturally lose a little bit of kidney function with age. While age is not a risk factor in itself, it does augment underlying health conditions a person may have. So how does your doctor detect a kidney problem? There's 2 tests that your doctor can do. One is a blood test, and that measures the amount of waste in your blood, called creatinine. The other test is a urine test that measures for the presence of protein in your urine. Normally, there's no protein in your urine, so if protein's present, it's a sign that there could be some kidney damage. So what is creatinine? Creatinine is a waste that's left over from normal muscle breakdown and rebuilding. Our muscles naturally release creatinine into our bloodstream, and our kidneys are responsible for filtering out creatinine and putting them into the urine. We can tell if there's a problem with the kidneys by testing the creatinine. If the creatinine is out of range, we know the kidneys aren't getting rid of enough creatinine. A normal amount of creatinine for men is 70 to 120, and for women it's 50 to 100. So if you go to the lab and you get your blood test done and you're a woman and your creatinine is about 150, the lab will automatically do a calculation based on that creatinine to come up with your percentage of kidney function. Measuring the amount of creatinine in your blood tells us that you might have a filtering problem with your kidneys, but it doesn't tell us if the filtering problem is big or small. Every time you go to the lab to have your creatinine measured, the lab will calculate something called an eGFR, and that's based on your creatinine levels. So what is an eGFR? An eGFR tells us the approximate percentage of remaining kidney function you have. The lab figures this out by doing a calculation using your creatinine, your age, and your gender. So an eGFR of 48 means you have approximately 48% remaining kidney function. Do you happen to know what your GFR is? So what is a normal eGFR? Under the age of 40, one would expect to have a kidney function of between 90 to 100%. After the age of 40, the GFR will depend on age, as we naturally lose a little bit of kidney function as we age. An eGFR of 60 or under requires more testing. By following your kidney function, you'll begin to recognize what your GFR numbers are. It's good to know that the numbers can go up and down and that this is normal and not to panic. If you get a copy of your blood test results, you can discuss them at your next doctor's appointment. So what can you do? Things that you do to take care of your health are called self-management strategies. That's when you participate in your care for a healthier outcome. The first self-management strategy is blood pressure management. Controlling your blood pressure is the single most important thing you can do to prevent further kidney damage, since high blood pressure is a cause and a symptom of kidney disease. Good blood pressure control is number one. Monitoring and recording your own blood pressure. If your blood pressure is not in your target range, you can purchase a digital upper arm blood pressure cuff from your local pharmacy. Write your numbers down and take your blood pressure readings to all your healthcare appointments. This will help your healthcare professional adjust the timing or the amounts of medications to get optimal blood pressure control. Know your blood pressure target. The ideal range for people diagnosed with a kidney condition is 140/90 or less. Let your doctor know if you're not meeting your blood pressure target. Ways to control blood pressure. If you're on blood pressure medications, take them as prescribed. Talk to a dietitian about limiting salt intake and get your body moving. 30 minutes of exercise most days can reduce your systolic blood pressure, that's the top number in the reading, by 5 to 10 points. Losing weight. Taking off as little as 10 pounds can help reduce your systolic blood pressure by another 5 to 10 points. Learning how to manage stress is also important for blood pressure control. Self-management strategy number 2 is blood sugar management. If you're diabetic, controlling your blood sugars can help slow the damage being done to the filters of your kidney, prevent further damage to blood vessels in your heart and the rest of your body. Monitor and record your blood sugar levels. Check your blood sugar levels at home on a daily basis before your meals. Record your blood sugar numbers in a logbook and take your blood sugar logbook to all your medical appointments so you can help your healthcare professional help you to make changes in your medications. Know what your blood sugar target should be. The ideal range for fasting blood sugar, that's the blood sugar that you take in the morning before you eat any food, is 4 to 7 millimoles per liter. 2 hours after eating, it should be between 5 and 10 millimoles per liter. There's also a blood test called an A1C. That's a blood test that gives us a percentage of blood sugars over about the last 3 months. So an A1C of 7% or less is the goal if you have chronic kidney disease and diabetes. Ways to control your blood sugars. Take your diabetic medications as directed. Follow the diet recommendations. You can make an appointment with a dietitian or a nurse at the Diabetic Education Center for help and guidance. Get your body moving to help burn the sugar and aim for a healthy waistline. Understanding your blood work results is self-management strategy number 3. We suggest that when you go to the lab to get your blood work drawn, that you ask to receive a copy of your blood test results. Most labs will be able to provide them by mail for you to pick up later, and some labs now offer online registration where you can sign up to receive and view your blood test results online. Learn about the tests that your doctor is ordering and what they mean. If you get copies of your lab work, you can review them before your doctor's appointment and go in and ask questions related to your kidney health. Be prepared to talk about results when you go to your medical appointments. This will help you learn about your chronic kidney condition and what you can do to keep in charge of it. Self-management strategy number 4 is maintaining an updated medication record. Keep a list of all your current medications, including non-prescription medications, any over-the-counter medications, creams, sprays, or inhalers that you might be on. Take a list of all your medications to your healthcare appointments, including trips to the hospital. Know what, when, and why, and how of the medications that you are taking. If you're not sure if a medication is kidney friendly, don't forget your pharmacist is usually very accessible in the community pharmacist near you, often without an appointment. Bringing others into the loop is tip number 5. Make sure all your healthcare professionals know about your kidney condition. If you get copies of your blood work, you'll be able better to inform them of what your current eGFR is. All doctors, healthcare professionals, anybody giving you any medications or tests need to know what your kidney function is. That includes doctors at walk-in clinics, emergencies, specialists, dentists, radiologists, and your pharmacist. Contrast dye is used for CT scans and is toxic to the kidneys, so make sure you keep everybody informed of what your health issues are. You might want to consider wearing a medical alert bracelet for extra safety. Stop smoking is self-management strategy number 6. Smoking hurts your kidneys by increasing your blood pressure and damaging your blood vessels. Speak with your doctor if you are a current smoker and consider looking into the Quit Now program. Note about alcohol. Did you know that alcohol can increase your blood pressure, increase your blood sugars, and impact the effectiveness of some of your medications? Alcohol in moderation may be acceptable. We encourage you to speak with your doctor about what the right amount is for you. Tip number 7 is getting your flu shot every year. Get your flu shot from your public health nurse or doctor every year before flu season arrives. While you're there, ask what other preventative immunizations you are eligible for through the public health office. Well, thank you for listening. I'm going to turn it over to the kidney care dietitian now, who's going to discuss eating healthy for your kidneys.
This section of the program covers healthy eating for your kidneys. This presentation is for informational purposes and is not intended to be a substitute for medical advice from a physician or nutrition advice from your dietitian. We will get started with a look at the main components of a kidney diet, focusing on protein, sodium, phosphorus, potassium, and fluids, and then touch briefly on some general nutrition guidelines and tips for how to merge diabetic and heart-healthy recommendations with kidney diet guidelines. We will finish off with an overview of the 2011 Canadian Physical Activity Guidelines. Protein is a nutrient in food that your body needs to build and repair muscles and tissues, help fight infections, and heal wounds. We require a certain amount of protein every day for these and other bodily functions. You may be wondering why protein is so important in kidney disease, so let's go to the next slide to answer that question. Normal digestive processes break down protein and create natural waste products that are filtered by the kidneys and passed out of the body in urine. If you eat too much protein, your kidneys have to work harder to eliminate the waste products. A controlled protein intake may reduce workload of the kidneys, reduce symptoms caused by the buildup of protein waste in the blood, and help slow down the progression of kidney disease. Some people may experience symptoms such as nausea, vomiting, taste changes, weight loss, and generalized itchiness. Please note that these symptoms may be related to other medical conditions, so it is important to consult with your doctor. While it is important to control protein intake to limit workload on the kidneys, it is just as important to get enough protein to help build and repair muscles and tissues, help fight infections, and heal wounds. Protein foods come from both animal and plant sources. Some animal sources include meat, poultry, fish, eggs, and dairy. Plant sources include tofu, nuts, seeds, dried beans, peas, and lentils. Generally speaking, women need 4 to 5 ounces of high-quality protein per day, while men need 6 to 7 ounces per day. This is a general recommendation and may vary based on your personal size or health conditions that increase requirements such as cancer, surgery, or malabsorption due to inflammatory bowel disease or other conditions. On this slide, you can see that each choice in the amounts shown are similar in protein content. 1 ounce of protein is equivalent to 1 ounce or 30 grams of cooked meat, poultry, or fish, 1 egg or quarter cup egg white, quarter cup firm tofu or half a cup of soft tofu, 1 ounce of cheese or quarter cup soft cottage cheese, 2 tablespoons peanut butter, quarter cup of nuts, 1 cup of milk or 3/4 cup yogurt. For many of you that have seen a dietitian in the past, you may have heard of this trick for estimating protein portion size. 3 ounces of cooked meat, chicken, or fish is equivalent to the size of a deck of cards. With these tools, you are now able to track your portions over the next few days to see if you are getting the right amount of protein. We will now take a look at sodium. Sodium is a mineral found in foods. It is a major part of salt. Salt is made of sodium and chloride. Your body needs sodium to help with water balance. Many of us eat far more sodium than our bodies require, in part because sodium is so abundant in the North American food supply. The Canadian average is 3,400 milligrams per day. So why is sodium important in kidney disease? Well, for many patients, limiting sodium in your diet can help control your blood pressure, which may help protect your kidneys, and also reduce the swelling in your ankles and legs. So what foods are high in sodium? You will see some familiar foods on the slide, such as ham, bacon, salami, and other deli meats, pickles and olives, and bottled sauces, canned, packaged, and instant noodle soups, salty snack foods like chips, crackers, and salted nuts, and table salt. In the average Canadian's diet, 77% of sodium comes from processed foods, 12% natural content, 6% table salt, and 5% in cooking. So how can we eat less sodium? Do not add salt at the table or in cooking. Limit high sodium, processed, and canned foods. Look for low sodium products at the grocery store. For example, choose tuna fish packed in water rather than brine. Choose unsalted crackers, and choose fresh produce rather than canned. Lastly, learn how to read labels. Let's take a look at the nutrition facts table next. Learning how to read nutrition facts tables will put you in the driver's seat to managing your health. Food labels are regulated by Health Canada and are standardized to look the same on each food product. Keep in mind that the serving size shown on the label may be smaller or larger than the amount you intend to eat. Let's look at the label. First, you see the serving size at the very top, which in this case is 1 cup. The amount of a nutrient is listed in consideration of the serving size. So for example, there is 70 milligrams of sodium in 1 cup of low-sodium chicken broth. Please note that regular chicken broth may provide more than 10 times the amount. On the top right, you will see percent daily value. This tells you how much or how little of a particular nutrient is in a given amount of food item, based on the daily value for that nutrient. The daily value for sodium, reflecting the amount that is appropriate for most healthy adults, is 2,400 milligrams, so 70 milligrams is 3% of the daily value. This leads us to the sodium recommendations for most kidney patients, which is less than 2,000 milligrams per day. This is recommended by the World Health Organization and the Canadian Natural Sodium Strategy. In rare cases, some patients may need salt. It is important to check with your doctor if you are unsure. Note that 1 teaspoon of salt has 2,400 milligrams of sodium. Let's now try a quiz. In the next few slides, we will be looking at a few foods, and we will guess how much sodium they contain. How much sodium is in 1 cup of Campbell's tomato soup? A. 350 milligrams. B. 530 milligrams. C. 770 milligrams, or D, 840 milligrams. 1 cup of Campbell's tomato soup has C, 770 milligrams of sodium. How much sodium is in 1 beef Oscar Mayer wiener? A, 210 milligrams, B, 460 milligrams, C, 520 milligrams, or D, 700 milligrams. 1 beef Oscar Mayer wiener, regular, not jumbo size, has 460 milligrams of sodium. How much sodium is in 1 large Heinz dill pickle? A, 310 milligrams, B, 460 milligrams, C, 640 milligrams, or D, 830 milligrams. 1 Heinz dill pickle large has 830 milligrams of sodium. How much sodium is in 1 Big Mac with cheese? A, 640 milligrams, B, 850 milligrams, C, 1060 milligrams, or D, 1630 milligrams. 1 Big Mac with cheese has 1060 milligrams of sodium. How much sodium is in 1 tablespoon of soy sauce? A, 310 milligrams, B, 460 milligrams, C, 715 milligrams, or D, 1025 milligrams. 1 tablespoon of soy sauce has 1025 milligrams of sodium. Now you can see how sodium intake can build up quickly and above the recommended 2000 milligrams, especially when choosing canned or processed foods. Let's move on now to phosphorus. What is it and why is it important? Phosphorus is a mineral found naturally in food. Phosphorus helps keep your bones healthy. Kidneys help balance the phosphorus in your blood. In kidney disease, phosphorus builds up in the blood, and over time, high phosphorus levels can lead to bone problems. In advanced kidney disease, excess phosphorus can also contribute to heart disease by depositing calcium in blood vessels and soft tissues. Sources of phosphorus include milk and milk products, animal proteins such as meat, poultry, and fish, whole grains such as bran cereal and dark breads, nuts, seeds, and legumes, chocolate, and cola. Note that most of these foods are considered healthy foods, which should continue to be included in your diet in appropriate amounts. Phosphorus additives are a large contributor to phosphorus in the diet. These additives are used to enhance flavor and shelf life in many processed foods, and it is difficult to know whether these additives are present in products. So do you need to limit phosphorus? Desired phosphorus level in the blood is less than 1.4. If your phosphorus level is above 1.4, talk with your doctor or dietitian. Find out your phosphorus level before you start restricting phosphorus in your diet. Previous diet suggestions in this presentation, including controlling your protein intake and limiting the high sodium processed foods, will automatically reduce your phosphorus intake. We move on now to potassium. What is it and why is it important? Potassium, another mineral like sodium and phosphorus, helps your nerves and muscles work properly. Kidneys help balance potassium in your blood. Kidney disease and certain medications can affect your blood potassium levels. An abnormal potassium level can interfere with your heart function and can be dangerous. So what foods are high in potassium? Good sources of potassium include fruits, vegetables, whole grains, nuts, seeds, and legumes. Some fruits and vegetables are higher than others. High potassium foods are often very healthy foods, and for the most part, patients can include them in their diets. You may be wondering if you need to watch potassium. Desired potassium level in the blood is 3.5 to 5.0. If your potassium is out of range, talk to your doctor or dietitian. If your potassium is too low, you may need to eat more high potassium foods or take a potassium supplement. If your potassium level is too high, you will need to eat less high potassium foods. It is important to know your blood potassium level to avoid restricting your diet unnecessarily. What about fluids? The ballpark estimate for healthy adults is about 30 milliliters per kilogram per day. This means if you are 50 kilograms or 110 pounds, you need 1,500 milliliters per day or 6 cups. If you are 60 kilograms or 130 pounds, you need 1,800 milliliters or 7 to 8 cups per day. If you are 75 kilograms or 165 pounds, you need 2,250 milliliters or 9 cups per day. If you are 90 kilograms or 200 pounds, you need 2,700 milliliters or 10 to 11 cups per day. Fluids include water, milk, juice, soup, pop, coffee, tea, pudding, etc. It also includes beer or wine. Pretty much anything liquid at room temperature is a fluid. Find your approximate daily fluid needs by looking at this chart. Sometimes you will need to drink more or less fluid than commonly recommended. You might need more fluid if you have fever, diarrhea, vomiting, kidney stones, or if you are losing fluid any other way, such as sweat if you're an athlete. You may need less fluid if you have congestive heart failure, liver failure, advanced kidney disease, or another health condition. If you have specific questions on how much fluid you need, please discuss with your doctor. This slide provides some tips for merging diabetic, heart-healthy, and kidney diets. How are these diets similar? With each of these diets, we suggest enjoying a variety of foods. Eat well-balanced meals, plus snacks if needed, spaced throughout the day. Control your protein portions, and control your salt intake. While merging the diabetic and heart-healthy diet, it is also important to limit simple sugars, such as added sugar on cereal, in your coffee, jam, syrup, pop, candy, etc. Limiting saturated fat by choosing low-fat dairy, avoiding fried foods, trimming skin off of meats, and changing cooking methods which use little fat, such as broiling and grilling. And incorporating high-fiber foods, such as oatmeal and other grains, peas, corn, raspberries, blackberries, apples, and pears with the skin on, and even popcorn. There are a few ways that diabetic, heart-healthy, and kidney diets are different. For example, if you have a high blood potassium level, you may need to adjust the types and amounts of fruits, vegetables, and grains you are used to eating. For example, you can change a big glass of orange juice into a small glass, or simply switch to cranberry juice. You can also choose rice instead of potatoes. If you have a high blood phosphorus level, you may need to adjust the types and amounts of dairy products, grains, or other foods that you're used to eating. As an example, you can limit milk to 1 cup per day. You can spread cream cheese on your bagel instead of Cheese Whiz. You may also limit cheese to only a 1-ounce portion a few times a week. Please remember that you only need to limit potassium or phosphorus if your blood levels are high. We will now move on to physical activity. Why be active? Physical activity has been shown to reduce the risk of over 25 chronic conditions, including stroke, hypertension, type 2 diabetes, obesity, heart disease, osteoporosis, breast and colon cancer. Other benefits of exercise include strength, flexibility, balance, coordination, falls reduction, mental health, and better overall quality of life. Research has shown that as much as half the functional decline between the ages of 30 and 70 is not due to aging, but rather inactivity. Essentially, physical activity helps prolong good health and independence. The Physical Activity Guidelines were developed and released in 2011. There have been significant advances in exercise since the mid-90s. They are based on reviews of the best available evidence. They were developed by Canadian Society for Exercise Physiology, and they parallel those of the U.S. and World Health Organization. Recommendations for children's 5 to 11, youths 12 to 17, adults 18 to 64, and older adults 65 and over are available. This slide shows the Canadian Physical Activity Guidelines for both adults and for older adults. For both adults and older adults, the recommendations are at least 150 minutes of moderate to vigorous intensity aerobic activity per week in bouts of 10 minutes or more. At least 2 times per week include muscle and bone strengthening activities that use major muscle groups. Remember, these are minimal targets and more is better. So what do we mean by moderate and vigorous intensity? Moderate intensity means you will sweat a little, and if you were to rate the intensity level, it would be a 5 to 6 on a scale of 1 to 10. Some examples would be brisk walking or cycling. If you are putting yourself through vigorous activity, you probably can't speak, sing, and you have an out-of-breath feeling. You may rate it as 7 to 8 on a scale of 1 to 10. Some examples of vigorous activity would be cross-country skiing, hiking, or swimming laps. If you find that even moderate activity is too difficult, there are many activities you can do, such as chair exercises. Talk to your doctor about what exercises are right for you. So how can you go about increasing your activity? First, consult your doctor about what exercises are right for you. Set simple, attainable, small activity goals. Invite a friend. Participate in a run or walk for charity. Join a small walking group. Check out activities at your local recreation center. This is the end of the nutrition and exercise section. The next item on the roadmap will be managing your medications.
Welcome to Managing Your Medications. A note about your pharmacist. Don't forget that your pharmacist is also your team member. You can ask questions. Pharmacists are often available even without an appointment. Feel free to pick up the telephone or drop by your local pharmacy to ask questions about any problems you have or questions about your medications. About medication changes. As your kidney function changes, so will your medications. What you're currently taking now may not necessarily be what you need over time. Your healthcare providers will work with you to ensure that you're getting what you need, when you need it, and at the right dose. Let's talk a little bit about common medications used in kidney disease. Since high blood pressure is the cause and symptom of kidney disease, good blood pressure control is often number one for most people. Often, more than one medication is needed to control blood pressure. Some of the common medications are called ACE inhibitors. These are medications that end in IL, such as ramipril, captopril, enalapril, to name a few. Some of the side effects of these medications are a cough. These medications work by reducing blood pressure and also reducing protein loss in the urine. Another category of medications used are called ARBs. These are medications that end in tan, such as losartan and valsartan. The other name for losartan is Cosar. These also help control your blood pressure. Other medications can help control blood sugars. As you heard earlier in the presentation, since diabetes or high blood sugars over time can cause damage to the kidneys, controlling blood sugars will help your kidneys. Some people need oral medications such as metformin, while others might need to be on insulin to help control blood sugars. Controlling cholesterol is important, and some people will need these medications. There's other preventative medications that are commonly used, such as a low dose or baby dose of ASA or aspirin. Balancing all your medications. What you want to do is maximize the effect of your medications, ensure you get the best absorption. For example, you might need to take the medication with or without food, and ensure that you're experiencing the fewest side effects possible. Feel free to talk to your doctor or pharmacist about the flexibility, the dosing, and timing of any medications that you're on. Reducing side effects. Medications have benefits, but they can also have side effects. A pharmacist's job is to minimize the side effects while maximizing the benefits. Talk about any side effects that you may be experiencing with any medications you're on to see how you can change them to have the least amount of side effects. Medications can often be taken differently or taken at different times a day to help reduce side effects. Don't suffer in silence. Please feel free to ask questions. Organizing your medications. There are a number of ways that people can use to organize medications. This might include a paper list that you keep in your wallet, blister packs that are created at the pharmacy, tablet organizers such as the one in the picture. Some people even have relatives or friends phone and remind them to take their medications at certain times a day, while other people might use calendars. What do you think would work for you? Medication lists. We suggest that you keep an updated medication list with you at all times and bring them to all your appointments. Appointments such as doctors at walk-in clinics, your GP, your specialist, even your dentist needs to know what you're on. If you go to the hospital for a treatment or procedure, bring your medication list there as well. This helps prevent drug interactions and duplications of things that you're already on and helps improve the safety of the medications. Here's an example of a basic paper medication list. You'll notice that it has the medication name, the strength, what time of day, like the directions, as well as what the medication is for. It's important that you understand what your medications are for to help you keep safe. If you prefer to keep track of things electronically, there's a variety of applications available for electronic devices that can help. Some keep track of blood pressures, blood sugars, and so on. We'd like to point out the MedRec app in particular is good for medications. It can help you with medication dose reminders, prescription refill, and medical appointment reminders. You can also email parts or all of your healthcare profile and history of when you took your medication to yourself or healthcare provider. As well, you can print your med profile and email it to yourself as well. So what should you avoid? Herbal preparations. Unfortunately, there are often not enough studies known about herbal preparations to be known if they can be used safely or not. They are not regulated. Vitamin preparations can also build up in the body when you have decreased kidney function. People with chronic kidney disease should avoid high doses of vitamin A and vitamin C. Pain and anti-inflammatory medications to be aware of. Over-the-counter aspirin should be avoided if you have a chronic kidney condition. Sometimes a baby aspirin or a small dose of 81 milligrams is prescribed by your doctor, in which case it's okay if it's for your particular condition. Aspirin comes in other names and can be bought over the counter accidentally. For example, Anacin, Acifin, Entrophin, Bufferin, Novacin are all forms of aspirin. As well, aspirin is sometimes put into other medications such as Alka-Seltzer, Excedrin, Midol, and things like Pepto-Bismol have aspirin in them. Make sure you check with your pharmacist or your doctor before you take anything over the counter if you have a chronic kidney problem. Tylenol is okay for the kidneys. If you're going to be taking Tylenol for a long period of time, check with your doctor as to how much you can take for how long. Other over-the-counter medications to be aware of are ibuprofen or anti-inflammatories, such as Advil or Motrin. By prescription, these medications come as Indocid, Naproxen, or Celebrex. Sometimes ibuprofen is put in other over-the-counter medications as well, such as Robax Platinum has ibuprofen in it. If you keep track of your current eGFR and you need something over the counter, you can then check with your pharmacist if the medication is safe for you. Over-the-counter cold and flu preparations to be aware of. Medications containing decongestants can increase blood pressure. Cough medications can sometimes include a lot of sugar in them, so for diabetics they can put up blood sugars. Also, over-the-counter cold and flu preparations may contain aspirin or ibuprofen type medications. Up-to-date medication information is available at your fingertips. Just go to www.bcrenalagency.ca Look for the For Patients tab on the top of the website, and then click on Medication Information for handouts and information on medications that are safe for people with chronic kidney disease. Covering the costs of medications. Do your prescriptions fit within your budget? If not, check with your pharmacist about generic versus name brand medications. Also, medications for kidney problems are also often used for other conditions and are usually funded by plans, such as Pharmacare or your private drug plan. Well, thank you for listening to the section on medications. We're going to turn it over now to the kidney care social worker, who's going to talk about navigating your way through the healthcare system.
As a social worker who provides services to people with kidney problems, I would like to make you aware of some key components in managing your health over time that will enable you to have better health care. In an overview, I will share some characteristics of our healthcare system in BC and Canada. I will talk about the changing patient role, which offers better health outcomes. This change comes from a relatively new concept in healthcare called self-management. It is especially applicable to persons with long-term conditions such as kidney disease, diabetes, arthritis, and heart disease, to name a few. Self-management means that healthcare providers are increasingly responsible for giving information and support with the goal of building a patient's confidence to manage their health conditions on an ongoing basis. I will also mention some resources that may be useful in managing your kidney disease. In the news media, we hear about long waiting lists for certain tests, physician shortages, and other limited health resources. There are some good things happening too. Our provincial government has made chronic disease management a priority. This approach to healthcare emphasizes helping individuals with long-term health conditions maintain independence and keep as healthy as possible over their lifetime. It accepts that patients are the best advocates for their own health care. This puts you in the driver's seat. Taking responsibility for your health includes working with your doctor. In this partnership, your responsibility as patient is to monitor your symptoms, report them accurately, and manage your health on a daily basis. Your doctor's responsibility is to provide medical advice, offer treatment options, and recommend resources. Besides your doctor, there are other health providers who may assist you in managing your kidney health. When the time is right, your doctor will make a referral for these specialty services. I want to take a moment to talk about the social work role in healthcare, as it is not well understood. As a recognized member of the healthcare team, social workers address social and emotional concerns as they relate to coping with long-term illness, injury, or disability. Their services include assessment, counseling, resource information and referral, and patient advocacy. I would now like to share some ideas on what you can do to make the healthcare system work best for you. It helps to learn as much as possible about your health condition. It takes the fear of the unknown away. The internet and your local library are good sources of information, as well as printed information provided by the BC Renal Agency and the Kidney Foundation of Canada. The only caution is to make sure the information relates to your stage of kidney disease. Also, Canadian content is most relevant. An additional approach is to ask questions of your healthcare providers. You may also want to talk to people who have the same health issues. This is called peer support. You will increase your understanding of your kidney disease and how it is being treated if you learn medical terminology. Here are some common words used by healthcare providers when talking about kidney disease. It is acceptable and to your benefit to ask the person to put the term in words that are easier for you to understand. With regard to doctor's appointments, the biggest issue is time. Time for you and your doctor to each get your questions answered. Doctors organize their services to patients in set time slots. A first visit is usually scheduled for a longer period than following ones. It helps to know how much time you have been allotted for your visit so that you can gauge your questions. You may need to make another appointment to get all your concerns addressed. With respect to your time management, you can exercise some control over the time you spend in the doctor's waiting room by scheduling appointments early in the day and midweek, or letting the receptionist know if you have other time commitments. Here are a few tips in managing your visits with your doctor. Between office appointments, it can help to keep a list of concerns or questions and put them in order of priority. If your list is long, bear in mind that you may get 1 or 2 concerns addressed in your slotted time. This means you will need to book another appointment. You should feel free to ask questions about your diagnosis, prognosis, tests, and treatments. Repeat back to the doctor key points discussed during the visit. It gives both of you a chance to correct any miscommunications. Take action by taking notes, writing down any instructions or recommendations. Let your doctor know if you are unable to follow any particular recommendations and why. More and more people are keeping their own health record, either written or electronic. Record appointment dates with your doctor and physician specialist you see. It is possible to request a copy of a physician specialist report if this is important to you. Other things to record include diagnoses that have been made, including allergies, symptoms you are experiencing, tests and results, copies of blood work from your laboratory visits, medications, future treatment plans. Make sure the plans are followed through. For example, if your doctor says they're going to reorder a test in 6 months and you have not heard anything by that time, you should feel free to make an inquiry as to why it has not taken place. Advanced care planning involves thinking about what is important to you in future healthcare treatment, should you ever be in a position of not being able to express your wishes. Your wishes come from your values and beliefs about life. Advanced care planning also means communicating your wishes to family, close friends, and healthcare providers, either verbally and or in writing. The BC Ministry of Health website contains a guide on how you would go about putting your wishes in writing, as well as how you would designate someone to act on your behalf. By having an advanced care plan, you give much needed guidance to the people that care for you the most in a difficult time. Self-management of a long-term condition involves 3 major areas. The medical area is well addressed by doctors, nurses, dietitians, and pharmacists. I would like to talk about self-management of emotions and social relationships. Sometimes the interaction between these 3 areas can create stress for us. Self-management of your emotions means getting in touch with your feelings, knowing what is a normal response to the health circumstances you are facing, whether it's a new diagnosis or dealing with change. It's important to seek support when emotions are uncomfortable or interfere with your personal relationships. It is important to view ourselves as part of a support network. Your support network includes family, friends, co-workers, neighbors, community services such as public transit and neighborhood recreation centers, as well as people that we pay for services such as gardeners and house cleaners. A big part of our support network, if we have a chronic condition, is our healthcare providers. Sometimes we find ourselves with not enough support or the right kind of support. By reviewing your support needs from time to time and taking action to address them, you will better meet your physical, social, and emotional needs. Remember, we human beings are social animals and that we help others and others help us. To help you in managing your kidney care, there are a wide variety of resources available through the Kidney Foundation of Canada, the BC Renal Agency, and chronic disease self-management programs in BC. Here are listed the keys to successful management of a long-term health condition. The more of these we are able to achieve, the better our overall health will be. When it comes to managing our kidney health, these self-management activities are recommended as they apply to your circumstances.
Well, thank you for joining us today in this guide to managing your kidney health. We hope you found it helpful and informative.